With us today, we have Dr. Russell Moy, who is the Harford County Health Officer, Dr. Sean Bulson, who is the Superintendent of Harford County Public Schools, Billy Boniface, who is the Director of Administration for Harford County Government, Edward Hopkins, who is the Director of Emergency Services for Harford County Government, and Sheriff Jeffrey Gaylor, Harford County Sheriff. And now it's my pleasure to introduce Harford County Executive Barry Glassman.
Good afternoon. Thank you for helping us share information about the coronavirus here in Harford County. Public safety is our highest priority, and my administration has been working closely with our allied agencies to prepare for the virus here in Harford County. As you know, Governor Larry Hogan announced yesterday a positive case in Harford County. The Maryland Department of Health is still investigating, so more details may become available. What we know is that the patient is an 86-year-old woman who contracted the virus while traveling overseas and is currently hospitalized. Public health officials report that there appears to be no community exposure from this case, and I will let Dr. Moy provide some additional details in a moment. There are no changes reported since yesterday, and at this time, we do not have any recommendations for schedule changes or community closures based on this case. We will be operating as we normally do in Harford County. Right now, it is important for everyone to stay calm and stay informed. Verified reports and timely updates are being provided by Governor Hogan and public health officials. Continue to take precautions, wash your hands, cover your mouth when you cough or sneeze, and stay home if you are sick. Continue to follow the recommendations from the health department. The website, harfordcountyhealth.com. Everyone here will continue working together, sharing information to keep our community safe as we move forward over the next few days and the coming weeks. At this time, I will turn over to Dr. Moy to give us an update. Dr. Moy.
Thank you. Again, I'm Dr. Russell Moy, Harford County Health Officer. The Harford County Health Department was informed of the county's first positive COVID-19 case by the Maryland Department of Health yesterday, March 8, 2020. The Maryland Department of Health is the lead agency for investigating this case, and our information comes from reports by their investigation team, and that investigation is still active. According to the reports we received, the patient is an 86-year-old female who contracted the virus while traveling overseas, and she is currently hospitalized. There appears to be no major exposure to the community, as this person went straight from the airport to home, did not exhibit symptoms until approximately 6 days after returning to the country, did not initially have respiratory symptoms or fever, but instead only had loss of appetite and fatigue. Decided to go to the hospital 6 days after her initial symptoms developed, when she was admitted to the hospital for medical evaluation and care. During this entire time, the patient states she did not leave her house and did not come into contact with people except for her immediate family, who have shown no symptoms and who are being asked to self-isolate and self-monitor for 14 days. At this time, we feel fortunate that the patient, on her own, basically chose to take all the actions that public health officials would have routinely recommended anyway, such as self-isolate, avoid interactions with groups of people, monitor for symptoms, and seek medical attention. We are hopeful that based on the information that we currently have, there will be no community mitigation recommendations made by the Maryland Department of Health, such as notifying large groups of people of possible exposure, necessitating self-monitoring, or the closing of any type of facility. Beyond these details, we have no additional information. and out of respect for the patient's privacy and the privacy of her family, will not be sharing any other identifying information. At this time, we think it's important to carefully continue monitoring this important and serious situation, and to stay calm, as the county executive said, and continue with common sense precautions such as washing your hands, covering your cough, and staying home if you're sick. Before I end, because this is such a new disease, and that the novel coronavirus was only discovered a little more than 2 months ago, and even the experts in the world are just beginning to get a handle on it, there are a lot of questions that we will not be able to definitively answer at this time. We should focus our attention on the high-risk patients for COVID-19, including those people age 60 and over with chronic underlying medical conditions, people with compromised immune systems, and those with recent travel to China, Iran, Italy, South Korea, and Japan. We should focus on known strategies for known conditions with respiratory symptoms, such as getting your flu shots to help prevent influenza. We should be wary of misinformation and rumors that might be found on social media. Our go-to authoritative resources are the CDC and the Maryland Department of Health websites, and even these websites have new information being added on every day. This is a new and unpredictable public health topic, but if it is addressed like other public health emergencies in the past, we will be okay. Thank you.
Dr. Bulson, thank you. Good afternoon. First, thank my partners in the county. We've had tremendous communication throughout this, as well as the communication we've had from the governor, keeping us up to date. As you can imagine, we are receiving many calls and emails and messages from our community with questions. So I just want to reassure everybody that we are logging those questions and concerns, and we'll be addressing them all in time. We're going to work on a way to communicate that publicly, most likely through our website. We held a conference call with our principals this morning and our senior leadership to help address this evolving situation. We shared a number of updates. At this point, similar to what you've heard from the county, we do not, I say that again, we do not have plans to close schools or cancel activities at this time. One piece of new information, we've asked our schools not to add new activities to the calendar because we don't know what the coming days may bring, but there is no plan to cancel anything at this time. We also have consistently through our messaging reiterated to staff and students and any guests who might come into our schools to please stay home if you are sick. And how we've defined that is anyone presenting with a fever of 100 degrees or higher should stay home until they're fever-free for at least 24 hours or have had additional guidance from their healthcare provider. Our priority is that our students are healthy when they're in school, so we're also looking at suspending perfect attendance awards and those types of things that many schools have. And we want to encourage people to stay home when they're sick and be in school when they're healthy. We also ask that our community adhere to these guidelines, particularly those around hand washing and that sort of thing. So let me turn the corner a little bit to some of the messaging. Of course, we always keep an eye on social media. And again, we've had a lot of traffic, a lot of energy there. Probably the biggest question we've gotten from our parents is about ensuring our students have opportunities to wash their hands during the day. In our conversation with the principals this morning, we directed them to be very clear and proactive in ensuring there are strategies that our students all have opportunities to wash their hands, particularly before and after lunch when they're in the biggest groups. But as it becomes possible during the day. But we want them to not only have very clear plans around that, but also to communicate that. And again, I already mentioned other concerns about things like attendance, perfect attendance awards, so again, we've canceled those. So, like others, we are relying on our local health department, the Maryland Department of Health, and the Centers for Disease Control guidance. We're keeping track of that daily. We ask those of us who are sending us communication, familiarize yourself with the resources that are available there. We want to look to those authorities, but of course the collaboration here in town is the most important part for us.
Now we'd be happy to entertain questions from any of our panelists here.
It was said that the 86-year-old woman came back to the U.S. from a different country. Do you know what country that was, where she was at?
So as we said, we will not be sharing any more identifying information out of respect for privacy for the family. And again, the Harford County Health Department is getting much of its information from the investigative team, which is the Maryland Department of Health. So they're the ones with that primary information. So I think we would be hesitant to be conveying information secondhand. We were just reporting what we've been told.
That's the county executive. I read a quote that you had said you were hoping Harford County would be one of the last places to get this, but now you're one of the first. Can you just talk to me about how that changes things at all? I know you said that you guys have had a plan in place like every other county, but how does that change anything?
We started a couple of weeks ago with our emergency preparedness. I think I was hopeful. As you know, the CDC and the federal government reports the testing for the COVID-19 virus is expanding exponentially each day with more folks being tested. Our information was not a matter of if, but just when we begin to see the increase in these number of cases, not only here in Harford County, but through the state of Maryland. So I think we've been planning, expecting it, just like the flu, to increase in numbers here in Harford County. And I anticipate that probably will continue throughout the state as we see more folks tested actually at healthcare providers.
Dr. Moy, can you tell us how many family members have self-isolated?
Again, we're conveying information secondhand. My understanding is that there are 2 other people in the household, and both have received recommendations from the Maryland Department of Health as to all the appropriate precautions.
And they're not showing any symptoms?
No, no symptoms.
Where is the patient being treated, or can you talk about any precautions that the hospital goes through to prevent the spread?
So we're not at liberty to talk about which hospital at this time.
Any more questions?
So it was said that, excuse me, let me go up.
That's fine.
It was said that this woman had no contact with anybody else. She got off the plane and went straight home, but presumably there were other people on the plane. Isn't that
So
possible?
the information we have is that she had no symptoms while she was on the plane and no symptoms for 6 days after returning from the country. So without symptoms, based on CDC criteria, she would not be a person under investigation. Her symptoms developed 6 days after her return.
And I think it's important to remember also that as these cases begin to develop and the state gives us additional information on the range of influence or the range of travel of the individuals, then we will get guidance locally on what we need to do next, if anything. So it is situational to some degree, depending on what the case presents itself as. And we'll be heading down to see the governor in a little bit and get an update. And if something changes, we will react accordingly, what the state asks us to do.
I know there was an issue in, I think it was in Washington State, where the paramedics were transferring people with virus, and they sort of got contempt. How did this woman get to the hospital? Did she take herself, or her family took her?
Family took her. Okay.
So if you're not showing symptoms, you're not contagious?
So CDC guidelines at this time have certain categories for persons under investigation. Most of those categories include you must have symptoms.
But that's under investigation, not necessarily contagious?
Well, the first persons under investigations are the ones that are people who they're concerned about contagion.
So what you're saying is there's no way that she could have given this to anybody else on the plane at the airport or anything like that?
Nope, not saying that. As I said, it's a new virus. The experts in the world don't have all the answers. I know they're looking at those issues right now. But right now, all we can do is just go by what the CDC and what the Maryland Department of Health issues as criteria, and so we act within those parameters.
But what you're saying is she just didn't experience, she didn't have symptoms while she was traveling.
Correct.
So it's less likely that she was contagious to other people on the airplane?
No, I did not say that. I'm saying that she did not fit the criteria for being a person that should be a person under investigation. But as far as the exact characteristics of this virus, that's yet to be seen.
You said her symptoms were a little different than what's been described with the majority of the cases, is that right?
Her initial symptoms were not respiratory or fever. Her initial symptoms were fatigue, loss of appetite.
Any more questions? Thank you all.
Thank you all.
Thanks. Thank you.
Oh.